right, so this is our weightlifting assessment. We're going to try to determine how ready Ethan is for Olympic style lifting. Ethan is a national level lifter for his weight class and for his age group. How long have you been lifting in the sport?
About 4 years.
So he has a 4-year age of lifting, which is going to be bigger because he may be kind of ingrained into some of his movement patterns and may take a little bit of practice to get out of his movement patterns. So the main thing we want to assess with this is our mobility and stability continuum. Mobility is the ability to get into a position, with stability is the ability to control that position, okay? We want to assess limitations and see if we can improve them. We're looking at his motor control. So there's going to be limited cueing on certain activities. Other activities will have cueing to see if we can correct. We're going to assess with and without weightlifting shoes, which are going to raise the heel and make some positions easier to get into. And we're also going to assess with and without a weighted barbell. So we'll have a PVC pipe, and we'll also have an empty barbell to see if the difference, if you can get into positions better with or without weight. So that is the overview of the start of the process, and then we will move on to the subjective portion from here. This is our subjective portion of the assessment. We're going to go over a few things that Ethan may have ongoing medical-wise, both in lifting and without lifting, and then also get a little bit more history on his lifting background. So, Ethan, how old are you?
16 years old.
Okay, and how long have you been lifting in the sport?
4 years.
Okay, were you working out prior to the sport, or was it just strictly straight into weightlifting?
I was CrossFit before I went into Olympic weightlifting.
Okay, good. Any past injuries you should know about?
I broke my right ankle about 4 years ago.
Okay. Was that right when you were starting the sport?
Right about when I was starting the sport.
Okay. Does that still give you any difficulty now?
Just an extension, but it's not too severe, and maybe in the squat, but again, not too severe.
Now, is it painful, or do you feel like it's limited sometimes?
Just limited. It's never painful.
Okay, good. Now, any ongoing injuries we should know about?
So I have a nagging injury with this wrist.
Okay.
It's really only painful in the catch position of my snatch.
Okay. And how long has that been going on for you?
About 7 months.
Has it been getting better or worse?
Significantly better.
Better? That's good. So we'll keep that in mind as we go forward through the rest of our exam. Now, as far as outside of weightlifting, any supplements that you're taking right now?
Creatine and whey protein.
That's it?
It's pre-workout.
Pre-workout. Okay. And what weight class are you in?
I'm transitioning to 102.
102? Okay, so how much do you weigh right now?
I'm about 106 to 107 right now.
Okay. All right, and any particular positional difficulty that you have, whether that's in your pull or in your squat or in the overhead position? You said a little bit of pain with the snatch in the overhead position. Anything else that you may struggle with maintaining your posture?
Mainly extension, and then when I'm trying to catch either a snatch or a clean and jerk, my foot tends to turn out.
Okay. No, that's still not painful, it's just something that it tends to do, right?
Yes, sir.
Very good. Any questions on anything else? So any other medical conditions we should be aware of? Diabetes, history of cancer, anything like that? Heart disease, lung disease? Nothing? All good. Cool. All right, so that will end our subjective portion, and now we will go on to some range of motion measurements. Yep. Okay. So now this is more of our objective portion. Right now we're looking at mobility, and so we're going to start with the pull and with the split positions. So first thing, we're going to have you put a small bend in your knees. Okay, I want you to try to bend over to put your hands to the ground, which is as low as you can. Okay, and then back up. So here we're looking to see just a general screen of hyper or hypomobility. Being able to get your palms completely flat on the ground is usually a sign of hypermobility, so we may want to assess more control later on in the screen. Let's go hands on the hips, and we're going to lean back. We'll do our backwards bending. Good. Back up. So again, we're looking at hinging patterns, where he is actually making his move at. As you go overhead, you need to have full thoracic and lumbar extension, just to be able to get in that position and support it. And now we're going to go down to our active straight leg raise. So lay down on the ground for me. Turn your hips so you face the camera right here. Scoot, 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 scoot. Good. Turn this way. 90 degrees. Sorry, 90 degrees. There you go. Okay. More turn. Turn, turn, turn. Thank you, sir. All right, cool. So now straight leg raise. Let's start with your right leg. I want your palms flat on the ground. Okay, and lift with your right leg. And then back down. One more time. Back down. Good. Left leg. Good. Back down. One more time. Good. Back down. All right, so this is going to assess two to three different things. One is just hamstring length in general and his ability to get to a full straight leg raise. We're also looking at motor control. So where does he start the movement from? Is it hip flexors? Is it his core? Does his core lose its stability once he gets farther overhead? And then also his back leg, if it comes off the ground, we need to assess hip flexors mobility as well. So let's go ahead and get that up. Okay. Now we're going to go into our press and lunge position. So I want you to go down into a put this on your chest. Go down to a lunge position. Good. And now I want you to press to get an overhead position. Good. All right. Now, so first thing we want to see is lunge position, where he is. If his knee is drastically in front, if his heel is off the ground, and how close his split is in general. Also want to look at his natural width for how wide he is, if he's in a stable position, relatively hip to shoulder width. Go ahead and space out more this way, so a little bit longer split. Good. Go ahead and stay on the platform. Back up. Stay nice and even. Good. Now again, press overhead. Back down. Press again. Back down. So you're seeing if the barbell and the PVC pipe can get into the correct stacked position, which is just behind the ears, over the shoulders, and over the hips. We want to assess this on both sides. So go ahead and switch legs. Good. And press. So both sides, he had a really short split to begin with. So space them out just a little bit. A little bit dynamic test to see how his hip flexor moves as well. Back down and press again. Very good. All right, and so from behind, we want to see are his hips rotating? Are they rotating anterior posterior? Are they rotating to the side? Whatever the case is, we just want to make sure he's able to maintain that position to reduce any risk of injury when he goes to the overhead split position. All right, and you can drop the PVC pipe. So let's stand. Right, so from here, we could go into our Thomas test to see if he had hip flexor limitations. He did that position extremely well for him. And so Thomas test would not be warranted in this case, but it is a objective measurement we can use to determine if he is limited in his hip flexor mobility. All right, for the next portion, we're going to work on our transition and overhead positions and stability. First thing we're going to work on is the snatch upright row. So we want Ethan to get into his natural snatch position, so the barbell should be between his pubic bone and his ASIS. And from here, I want you to just upright row. Lift the bar as high as you can, and then back down. Right, turn 90 degrees so you're right here. Go again. Back down. So what we're looking for here, one more time, is symmetry from left to right, making sure the barbell stays parallel to the floor. That's good. And then we're also looking for his dynamic internal rotation. So what we want to see is the barbell get to essentially the nipple line with the elbows up and back. What we don't want to see is almost like a reverse curl. So show me here. We don't want to see that to get the bar elevated more. Okay, so show me the first one again. This would be good. This is considered the pass. Elbows are able to stay up and back, and his wrists are relatively in a neutral position. We don't want to be in a bent wrist position either. So again, we'll go from here. That's a measurement to see if he can get into this position for the pull. From here, we're going to go to more shoulder work. We're going to do our apple scratch test. So I want you to turn and face the wall right here. So right hand first. I want you to aim for the top corner of your shoulder blade right here. Good. Back down. And I want you to reach up and behind right here for the bottom corner of the shoulder blade. All right. So he has pretty limited internal rotation for the right shoulder. External rotation was great. That's good. Now we'll go left side. Again, pass for external rotation. Let's see the internal. Reach up. And this would be a pass. So right now he has limited, that's good. Right now he has limited internal rotation of the right arm. It may be something we need to assess later on, especially when we start getting into more pulling positions and then into overhead positions as a whole. So to further assess his overhead position, we're going to go to a back to the wall with our arm slides. So I'm just going back against the wall. We're going to measure this two ways. One's going to be standing, so elbows at 99. Good, and I want you to slide up the wall, keep the elbows and hands against the wall the whole time. Good, what we're looking for here, again, is movement control, making sure his back can stay against the wall. Slide back down. Try to do that again with your back staying flat against the wall. Good, go ahead. Back down. All right, and now to simulate this in a more Olympic style position, we're going to go into a squat. So just do like a wall sit, slide down. Good, and now press again. Smooth back down. One more time. And back up. So stand up. So if he's limited in a standing position, his back really arches off the wall. There could be limitations of thoracic or lumbar mobility. It could also be just limitations in core stability and motor control. If he's limited in a squatted position and he starts to have to either tuck his butt out or has to compensate in other positions, it may be more of a lat length issue. And so for that position, we're going to go into our lat testing. So let's lie down flat on your back. Let's scoot back this way just a little bit. That way. Good. All right, so first position, we'll keep your legs straight. I want you to take your right hand and put it all the way to the ground overhead. Good. Back down. Left arm. Back down. Bend your knees. Right arm again. Back down. Left arm. Back down. Good. So he's able to get his arm fully flat against the ground, which is what we want to see. However, he does have a little bit of rib flare for each of those. So what we want to try to do now is try to cue him and be in that correct position and to reassess. So let's go straight legs now. All right, now try to keep your ribs down the whole time. Push down into my hand. Good. Now go right arm. Good. So he still has some rib flare up. Back down. Switch. Good. Back down. Bend your knees. Same thing. So core stays tight. Reach overhead. Back down. Good. Left side. And then back down. So it may not be as much of a lat length issue as it is a core stability issue. Regardless, we need to be able to get his core to stay tight as he goes into overhead position so that his lats are not the limiting factor. Yep. I'm not helping you this time. All right, and so last thing we're going to do is our wrist extension on box. We're going to assess this in two different ways. One, we want your wrist to go into full extension, and then we're going to go to radial deviation. Okay, so we're going to test this first with our fingertips extended. We're going to go into full wrist and elbow extension, and we're going to go into radial deviation. All right, and again, we're looking to see if the back corner of his palm can maintain contact to the box throughout the whole movement. So go into full wrist extension, maintain elbow extension, lean forward. Good. Any pain, pressure, anything here? Tight, not painful. Okay, back off. All right, now we'll reassess with fingers on the edge of the box right here. So it's more simulating holding onto a barbell versus having full finger extension, which is going to stress the finger flexors more. So off to the side, good. Full elbow extension, full wrist extension, and then full lean forward. Good, and then very good. Ease back off. Now is that less, better or worse there? Better. It's better? Okay, so he may have a little bit of finger flexors limitation, but in this sport, most of the time you're in a finger flexor position, that is not going to be unexpected. So that is going to be it for our transition and overhead position. And from here we go to our squat assessment, and we can assess the hips and the ankles a little bit more from there. So this is the range of motion assessment for the squatting position, particularly the overhead squat position and the front squat position. So for the overhead, we want to make sure the hand width is the same as the snatch position. So the bar wants to be below the ASIS and above the pubic bone. So he's in a good position here. So we want to transition to go overhead. Good. All right, and I'll squat down. Good. And back up. Squat down. Turn 90 degrees so we can't go here. Good. Too far. Right there. Good. Back up. now turn and face the camera. Squat one time. Good. Back up. So from the side view, we want to make sure that the barbell stays above behind his ears, above the shoulders, and even with his hips. As he goes down, go ahead and turn the squat from the side one more time. As he goes down, you can see, too far, barbell at the camera. There we go. Squat down. As you can see, the barbell travels forward. It's way in front of his feet, which is not going to be good for balance once we get to that overhead position. So this is what we were talking about earlier. We will reassess with shoes on. He did mention earlier that he had an ankle injury. We want to see if that is maybe a limiting factor for this position as well. At the same time, lifters also become accustomed to having a downward force to help them get into the correct position. So we're also going to test with the barbell. So, barbell. Pick it up. We're going to do one facing forward this way. Go ahead. Back up. Just bang out a couple. Good. And now turn the barbell towards the camera. Okay. Squat facing the camera, that's fine. So from the frontal view, we want to make sure that he is not shifting left to right. You see his left knee kicks out a little bit more. His right foot is turned out a little bit more. Stay back up. You don't have to pause the whole time. Just kind of bang out a couple. Yeah. Rest if you need to. All right, so from that point of view, we want to make sure everything is even front to back, and then also from shifting from left to right. So rotational component, we're going to see a little bit better from the side angle. Go ahead and squat down. So, and looking from the back, we want to make sure his shoulders are in internal or external rotation. Good. Back up. So, rest for a second. So, you don't need maximal internal or maximal external. It's more about when the lifter is comfortable. But we do like to see some symmetry from left to right. We don't want to see one completely externally rotated and the other one compensating with the internal rotation. As long as they're even from left to right is the main goal here. So let's turn and the barbell will be facing the camera now. Perfect, right there. Pull up. Right here. Go ahead. So from the side angle, again, we're going to see if the barbell travels forward, backwards, when squat. So as with a barbell, he is a little bit better up and down. Probably because he has some more downward force from the weight to help get him in the correct position. You don't have to pause. Just hang out a couple. And from this angle, also seeing if his hips are shifting anterior, posterior, if he's compensating with forward trunk lean, whatever the case is. Do the rest. Back down. All the way. Good. Let's go and put your shoes on. We'll do overhead, front squat first. So from that perspective, we know that he has limited ankle range of motion right now, and we're going to assess that later on with our dorsiflexion against the box. His internal and external rotation of the shoulders looked even from both sides. He did have some forward displacement of the barbell, which may change when we put his shoes on, which is what he's accustomed to lifting in. Ideally, you'd be able to reach these positions with or without compensation with shoes, with a barbell, whatever the case is. But if you've been training for 4 years, you may be a little bit more dependent on these positions to get in these positions with the equipment. So let's go hands on. We're going to go to front rack position. Now, front rack with the PVC pipe is very hard to get into. We want to see if he can get the PVC pipe to his chest, right? Which is going to require full elbow flexion, full wrist flexion, and then also a lot of shoulder flexion, okay? So we're testing our triceps and our lats out here without the assistance of the weighted barbell. So try to squat in this position. Good. Back up. One more time. Back up. Good. Now barbell towards the camera. Turn. Right here. Turn forward. Good. Go ahead. Squat. Same thing we're looking for the overhead squat is if there's a forward translation of the barbell, which there's a significant one with him. His hips, his back seem to be in a good position. He may have a little bit excessive trunk flexion, which may be due to, again, limited ankle dorsiflexion. So we'll further assess in just a second. If you go ahead and turn towards the camera again. One second. All right. Good squat. So from the frontal view or the rear view, we're going to look at ankles, if they turn in, if they turn out, if his hips shift left to right. As again, you can see his right foot turns out more and more weight goes into the arch of his foot. Ethan is a pretty flat-footed lifter. Not a huge deal. It's just gonna have to compensate from other positions. Freeze 1 second. So you can also see his fingertips, right? Fingertips are starting to go all over the place. That may be due to the barbell not being there for him to hold against himself, but it also may be due to a limitation of lat mobility and tricep mobility to keep his hands in the correct position. So let's do that for me. All right, let's hit 2 of each position with the barbell. Starting facing forward. Again, this 3/4 angle is going to be just a general overview of the lift. Does the lifter look comfortable in the positions? Are they able to reach the positions? Okay, so go ahead. Good. Again. Good. So you see he moves a lot better with a barbell in place versus a PVC. Just to turn barbell towards the camera, right there. Squat down. Pause 1 time in the bottom. Back up. As you can see, the barbell is rotating forward to the right. So we need to determine if that is due to limited ankle dorsiflexion on one side versus the other. His hands have lost their grip, and the bar placement itself is going forward each time he squats. So now let's turn and face the camera. And squat 1 more time. Back up. Good. Good. Back up. Good. Back up. So he was able to reposition his hands and hold a better position. Likely that was due to us talking about it, but that is some cueing that we may need to address as we get into heavier weights and as he lifts throughout his sessions. Did you have any pain with that?
It's definitely tight through my right ankle.
Okay.
It wasn't painful.
Okay, that's good. We'll let the wrist from before. Okay. So we do know that he has a limited, that he said he had limited ankle mobility. So we're going to assess that with our box test, okay? So we have our box dorsiflexion. So I want your left foot to be on the measuring tape, right knee on the pad. We're going to get right here and try to touch our knee to the box, okay? We want to watch this from behind as he goes. So from the side angle, we want to see how far he can get to the tape. The goal is 5 inches, so that was good. Slide back just an inch, not 7 inches, just an inch. There you go. Now from the side, or from behind, we want to make sure that he's getting it from his actual ankle and not from the midfoot. So right now his foot is collapsing a significant amount. Come back out. So I want this knee to go out. I think I'm going over the pinky toe. And now he has an early heel rise, so that is going to come from limited ankle dorsiflexion, whereas, again, he's flat-footed lifter. He probably compensates a good deal from his midfoot. So let's do that one more time, facing right here. We would obviously compare left to right. We want to see some symmetry. So right knee here, left ankle again. Go ahead, and we're going to, from this angle, we'll pay attention to his foot position. So foot is collapsing a little bit. We want to keep the toes straight ahead so that he can actually, there you go, good. And that would be considered a quality test. We can actually measure this, put an objective measurement from left to right. So for left foot, he got 4 inches. Again, the goal is 5 inches. So we're going to go back to this side. Let's test with the right foot now. Right ankle's the one you broke, right? Yes. Okay. Squat close. Go ahead. Again, angle towards the pinky toe. Right, so his rear foot is already spinning. He's compensating through the forefoot, and he is at 3 inches on this side. So technically it's only an inch difference, but it's also 75% of the other side. So that is something we can obviously address to hopefully help improve your squat position and your ankle dorsiflexion as a whole. Okay? Cool. You okay? Yeah. So that'll be it for the range of motion assessment, and we will move on to our stability portion from here. So now that we've done all of our testing with our barefoot, or with our athlete barefooted, we are now going to use his Olympic weightlifting shoes. Weightlifting shoes tend to have an elevated heel of about half an inch to up to an inch. That helps provide a elevated heel, which helps provide a more upright posture to make the positions easier to get into. So we're going to reassess all those positions with a PVC pipe, and then we're going to reassess with the barbell again. So let's go overhead squat. Again, from the 3/4 angle, this is a gross range of motion. Trying to see if it's if the athlete looks comfortable, good, relax, and if you can meet most of the standards from the side, or from that angle. Okay. Right here. Now from the side angle, we're looking again for rotation of the athlete. Go ahead and turn a little bit more. Right there. Fix your feet. Okay, go ahead and squat. Again, forward displacement of the barbell, rotation of the barbell, and then also looking to see if you can maintain a correct lumbar hold the whole time. One more time. Good. As he looks a lot more stable, he has a more upright posture here with his upper back and lower back, and then also he has less butt wink that you can see. So let's turn the face towards the camera now. And then from the front, we are now assessing his rotation of the hips left and right, and then his foot placement. So because he has shoes on, you can't see his actual midfoot or his arch, but you can also continue to look at the heel to see if it has any kind of inversion either. So let's turn it all the way around. 180. This way. Squat again. Yeah, he has this subtle shift in the right ankle. Left ankle looks solid. Go ahead. Back up. But again, the barbell stays in one plane up and down, doesn't have nearly as much forward translation. So this again does not mean that he has failed the test, it just means he is much more comfortable in shoes compared to without shoes. So we're going to reassess with the barbell for overhead squat. We're also going to reassess front squat with PVC pipe, and then front squat with the barbell. So go ahead and grab the bar. Same hand placement. Good. Squat in. Good. Turn towards the camera. The barbell towards the camera. Good. Right. There. Go ahead. Then looking for barbell tilting, looking for rotation, looking for forward and backward displacement. Right. And quick turn and face me. Now from this angle, watching the heels to see if there's any difference. So with this position, yes, we are loading it, but it actually may help him get into certain positions because it gets a little more feedback as to where he is, and also helps push him down into the correct position. One more time. Good. As you see, the barbell's tilted down a little bit, but as far as his lower extremities, everything looks good. Right ankle's still a little bit tilted, and we knew that coming in. So let's put it down. Trade it to the back to the front rack position. So improvements, improvements from no shoes versus shoes, much less forward displacement, still has rotation, still has a little bit of ankle limitations, but it is improved due to the shoes. So let's go ahead, front rack position. Bang out a couple. Good. And also get feedback from the athlete. So where do you feel like your weight distribution is in your foot right now? Front of the foot, back of the foot?
It feels about 3 midfoot to feel.
Midfoot? Okay, good. So let's turn barbell towards the camera right here. Good. Go ahead and go front rack. Back up. Good. Squat. Good. Good. So a PVC pipe is going to be hard to maintain the true front rack position just because it's so light. But we would still like to be able to get into those positions actively, even without the assistance from the barbell, correct? So let's turn and face the camera now. Okay. Good. Small rotation to the right. Barbell is still kind of tilting a little bit back and forth. And again, chalking that up to the ankle right now. Once we can treat and reassess at the end, we can determine if that is the true main culprit here. So let's take this, down the bar. Right, looking at the front rack, elbow height, go ahead. Good, so he does a great job of maintaining the elbow height, maintaining his hands in the bar. One more time. Good, and then turn barbell towards camera. Here, go ahead. Then looking for lumbar arch, which he's able to maintain. Still has that forward translation of the bar. So let's turn towards me, or excuse me, towards the camera. second. So before that one, left foot is turned out a little bit more, his knee went out more, and he rotated the bar to the left. So do it again. Back up. So again, he's shifting his hips right a little bit, but the weight is turning to the left, which again is preserving that right ankle. So let's go and put that down. So that's the follow-up to the range of motion testing, kind of leading into the stability testing. But we still want to see what positions he can reach with and without weightlifting shoes, with and without any assistance from a barbell, in order to assess, what positions you can truly reach yourself or what you technically need assistance to get into, whether that's by equipment or by weight. Okay? We'll move on to our isometrics and positional holds next. All right, so this is for the stability portion of our exam. We are looking to make sure the athlete can hold certain positions that are typically the most challenging for Olympic weightlifters, and making sure they have the stability and the endurance to do so as loads increase. So because this is a lighter screen, we are not going to max them out, right? Everybody's going to lose positions once they reach their maximum potential. We want to make sure that he has a good movement pattern for when he does get to maximum potential, that it is not going to become a flaw for him. So first thing we're going to do is our squat hold. We're going to do this with a front rack position. This is up to the tester as far as front rack versus overhead squat versus back rack. I prefer to use the front rack position simply because that's where you're going to spend most of your time squatting, as the front rack recovering from a clean. And it's also going to be the position that people lose the most when they come out of a heavy squat, is the front rack. So let's go ahead and grab the bar. And then, as you would normally front squat, I want you to hold that bottom position as good as you can for 30 seconds, okay? And so a couple things we're looking at is comfort of the athlete. Is he having to constantly shift, move around? Is he losing fingertips? Are his elbows tall? Or his wrists fully extended? Whatever the case is, right? So from the side view, we're making sure that he maintains a lumbar arch. He doesn't gradually go into a butt wink. He doesn't have hip shifting left to right, barbell shifting, turning, anything like that. So as you can see, he's a little bit kind of fidgety in the bottom position. Let's go ahead and stand. Good, and put it back down. So overall, did not lose position, was able to complete the test, so that would be considered a pass, right? Not looking for, what we don't want to see is the athlete completely lose a rounded position of the upper back or the lower back. Next thing we're going to do is going to be our star plank. So we're going to test this bilaterally with a goal of 45 seconds. Let's go ahead and face the camera, so hand and foot down. So this is great for weightlifting because of, let's go ahead and get you in position. Good, hips forward just a little bit. Good, stack everything up. Okay, bring this leg in the air. Good. Keep that hip forward in this position. Right, and then fall. All right, so let's get into a good testing position, then we'll start the timer, okay? Go back up. I'm gonna put you where I want you, and I want you to stay in that position, okay? Okay. Okay, lift this foot. Lift. I want you to be right here, up and hold, and then bring your hips forward some. Forward. Don't roll. There. Now lift. Hold. Ready? Go. Hold. Okay, so if we're unable to get into the correct testing position, we can always modify to have both feet on the ground. So let's go back in that same position. We'll just go to a standard side plank. Hands on the ground.
Right?
That's fine. Yeah. Good. Now push your hips forward. Rotate some. Rotate this way. Good. Now hold that position. Hold. So this is a great assessment for weightlifters because of the wrist and elbow extension we have to hold and maintain. Shoulder has to stay in the same position. Okay. So for traditional side plank, or for the star plank, we would like to see it for 45 seconds without a flaw. Side plank, we would actually aim for a minute. Keep hips tall, don't let them fall. So he's already having difficulty getting into the testing position and maintaining the position. So, back down, good. Minute 24, that would be considered a fail. Does not mean he can't do weightlifting, just means we may need to assess some strength of the obliques and the lateral musculature and make sure he can actually keep his knees from collapsing as he gets heavier. So that's the other side. Left hand, right hand. Where are you going? Face this direction, that's fine.
Right here.
Yes. left hand down, go into the side plank. So again, we would start with a star plank to see if we can reach that position. Good. Hand up in the air. So, relax. So he's having difficulty, relax for a second, back down. He's having difficulty to get to the star position, so we would not test that. We would actually test the traditional side plank. So hand on the ground, right hand on the hip, and then both feet stacked at the bottom. Good, all the way up, up, up. Push yours forward a little bit. Ah. Turn. Turn. Go this way and bring it yourself. There you go, good, hold that position. Hold. So now we're actually in a testing position. We'll start the timer. Again, stay punched into the ground, elbow and wrist stay locked. So, made it 8 seconds on that side. So, this is something Ethan may be able to work on. Now, did it hurt your wrist at all, or was it just hard for you to complete?
This one was a little harder on the wrist.
Hard on the wrist? Okay, so we can always take that back and look at the wrist, make sure that's not going to be a structural problem. As far as a strength issue, this is something we can continue to address for him. Now, moving on. You okay? All right, so we're going to move on to our SATS press. SATS press can be completed one of two ways. First one is going to be in a snatch position behind the back. You are pressing the barbell while maintaining a squatted position. So we're looking at a couple of things here is make sure he can maintain a passable squat and then also reach the position that we need to reach with the press. So we're going to start with a snatch behind the back, okay, and then we'll go to a front rack after that. So pick it up. Still going to be snatch grip, like we've been doing. I want you to start an overhead squat. So start here, good, go down to your overhead squat. Now control, bring that to your shoulders. And then press from there. So, do about 5. Now what we're looking for here, can he do this without losing his posture? Does he have to bounce? Does he have enough upper body strength to press the bar while maintaining his lower portion in the squat position? Those were great reps, stand up. Good, set it down and rest. This would also be tested with a PVC pipe just for mobility, or a training bar that may be about 15 pounds if someone is either a newer lifter or they're not quite as strong, especially in this position. We can try to get a standard test so we can test now, go through our treatments, whether that is through today or the next 6 weeks, and then we can reassess later on, okay? So now let's do our front rack position. So this is gonna be hands in the jerk position. Squat all the way down. This is harder to complete typically, so, okay? Good. Back down, let's do 5. Again, is he able to maintain lumbar stability, or is hip stable? Does he have to bounce the bar to get it overhead? If he had to bounce, we would probably get a lot of barbell just to test if it's his strength is an issue, or if it's his balance and stability is an issue. Very good. No issues there. No pain, no problems? Very good. Great job. All right, so from here we're going to move on to our press and lunge. And we're actually going to hold this for 30 seconds again. We did a press and lunge earlier with a PVC pipe to assess the mobility of the thoracic spine and the shoulders. Now we're going to do it in a loaded position to make sure that you're able to do it and support yourself while you go into a split jerk position. Main difference here, whereas before we were kneeling down, so now we're going to hold about a 1-inch split off the ground. Okay, so you're basically holding a lunge position, barbell in the ground. Okay? Okay? Hands are going to be in jerk position. Jerk position, front rack. Good. Go ahead and go into a lunge position. Split jerk, bring the knee down nice and low. Good, now press and hold. And we're going to start our timer. So, again, looking for balance from left to right, making sure his feet are hip to shoulder width apart, making sure he's evenly balanced front to back. We want a bent back knee, we want weight to the toes, we want the knee to be completely vertical, straight over the ankle in front. See if you can hold this position for 30 seconds. Good, back up. So, rest. I'm gonna rest for a second, then we'll test the other side. So in weightlifting, you're gonna have, typically you will only split jerk with 1 foot in front. Ethan actually is a power jerk. He does not spend much time in the split jerk position anyway to begin with, but we would like to test both sides to see if there's any kind of differences, okay? So rest for a second, and we'll go again. He was able to maintain the correct position, however, he did have pretty much increase in shaking right around the 15-second mark, so it may just not be used to being in that position to begin with. So let's go ahead and other side. Let's go left foot back this time. Go ahead and, 1 second. Go ahead and turn barbell towards you. Just give it to the side view. Go ahead up there. Yep. So press down this way. All right, so now we're starting our timer, and good. So he made the adjustment. Main thing we're looking for here again, bent knee on the back leg. We don't want it straight. Weight through the toes. Internal and external rotation of the feet. We would prefer to have them both slightly internally rotated. The knee needs to stay stacked over the ankle, which this one's a little bit in front. Still a strong position. Making sure he's not tilting left to right. Making sure the barbell does not twist from left to right either. There we go. So, rest. So a pass-fail for this would be, rest. Is he able to maintain that position for 30 seconds? Yes or no? And then stuff we can work on is body position. So either getting his feet split a little bit different. That can be just cueing to communicate with the athlete or the coach, that we can address over time. So we have one more test. This is going to be our Sorensen hold. A norm for the Sorensen hold is a 240-second hold, and that is with a flat bench with a strap across the top of the pelvis, behind the hamstring, and behind the ankle. This can be modified, and it can be completed in a GHD hyperextension machine. So we're going to test here. We don't have straps for behind the hips. The norms can stay the same. So let's go ahead and get in that position. We'll tire and Ethan out. So the goal is you want the feet and the hip portion to be the same height. Arms are going to be across the chest. You're going to have something in front as a starting point landmark. Okay, so I want you to go up and maintain a flat back. Go ahead. Again, 240 seconds is a very, very long time. So make sure he is able to maintain a flat position throughout. Norms for this test, again, 240 seconds is the goal. Study was done with less than 176 seconds is a good predictor of current or future back pain, and less than 198 seconds, greater than 198 seconds would be an indication of no current back pain or predictor of back pain. So, again, we would test this for the full 4 minutes. We're going to go ahead and move on from here. There we go. He was able to hold 30 seconds with no issues, but again, it's still 3.5 minutes away from the end goal. So that concludes our isometric holds, our position holds. So one thing we got out of it, may need to work on wrist mobility, stability because of pain in the plank position. We also need to work on just some lateral stability. He's demonstrated more than once some tilting left to right, some rotation left to right. So that could be something we could work on with either his hip abductors or his obliques as a whole, trying to make sure that he is able to maintain an upright posture and correct posture throughout his lifts and throughout all his accessory work. Okay? Very good. All right, so the last portion of our assessment is going to be load acceptance. This is ultimately what can determine if a weightlifter is safe or unsafe. If they're unable to accept load on their chest or in the overhead position, they may not quite be ready to start loading that position more than, say, an empty barbell, a PVC pipe, or a training bar. So we're going to step up first. This is not Olympic oriented. This is just simply, can the body accept load? Okay, so we're going to step off. I want you to catch in a firm, set and solid squat position. Okay. Very good. One more time. So this is just a step down into a squat. We're doing it forward as far as most athletes would be concerned. Go ahead. There's no difficulty with that. Let's go and turn around. And so Olympic lifting, a lot of our catches are going to be going slightly backwards, whether that's pulling away from the clean or catching in the snatch. So we want to be able to make sure his momentum going backwards is also stable. So go ahead. Good. Still stable. Good. One more time. Good. Good. Making sure his feet land in a natural position. We don't want one foot turned way out, the other one turned in. His hips stay nice and even. Everything stays balanced across the board. Okay, so we're going to go here. Now we have a few different loading variations. For the first one, we're going to work on our snatch. We're going to call this our snatch balance. It can also be referred to as a drop snatch. Just depends on the terminology that you're around. He's still going to have his snatch grip, excuse me. All right, so he's going to go into a fully extended position and then drop straight underneath. Hold that position, back up. Good, now turn the barbell towards camera. Up there, go ahead. Again. So again, we're looking for, oh, one second. Turn a little bit right here. Turn your feet with it. There you go. So, looking to make sure the barbell stays in the streamline up and down. Doesn't turn, right? Doesn't tilt left to right. And making sure he's able to support, we don't see a weight shift front to back or any type of double clutch at the bottom of the squat. So I'm back up, turn and face the camera. And again, making sure our feet are landing in an appropriate position. So he's starting from this pulling position with his feet, landing in his squat position. There, very good. Again, small tilt to the side. At least he's been consistent throughout all of our testing, right? So now, back down. We're gonna go work to our clean position now. So this is going to be called a tall clean. He's going to take out all extension out of the lift, and so he has to pull himself underneath. This is a higher skilled activity. It may be harder to teach correctly, but we want to make sure that, again, he is able to pull himself under the bar safely, and he's able to stop the barbell where he needs to stop it and in a safe position. Great job. Making sure he doesn't double clutch with the hips anywhere. Turn. Okay. Go ahead. Full extension. Great job. Back up. So the barbell, again, we want to catch the bar over our hips and our heels, or our ankles, excuse me, and it doesn't shift front to back. So I was trying to face the bar, face the camera. Good. Looking for solid feet transfer, and then making sure the bar doesn't tilt from the front view. Good. And back up. So he's lost, freeze. So he's got one pinky off, he's got two fingers off over here. Okay? Back down. So it could be, again, some little bit limited wrist mobility, triceps mobility, or lat mobility. Let's turn back to neutral. Need to rest for a second. Okay. The last one we're going to do is our tall jerk. So we're going to go into our tall jerk position, and then we're going to drop quickly underneath into our locked out jerk position. Again, we're going to pause on the reception of the bar. Ethan is a power jerker, so he's going to demonstrate his lift, which is a power jerk, and then we're going to do a couple with a split jerk just to show the differences. So, okay. Let's go ahead and let's do one of each position. One of each angle. Great job. Back up. So that, again, that's a power jerk. That's what Ethan does. That's what he's used to doing. So let's turn. Again, make sure the barbell goes in this good position. Go ahead. No shifting, no twisting. Everything looks solid, nice and stacked in a vertical position. So now let's turn and face the camera. All right, and go do one more power jerk. Good. Internal, external rotation of the shoulders. You'll see that in the elbows and the wrists. Everything looks nice and even. So from this position, go ahead and do one jerk, split jerk from here. Freeze. So want to make sure, again, his split this way, long ways, is good. His knee stays over his ankle. Both his feet are turned in slightly, and he's not too wide or too narrow for a good base of support. Let's turn and face left. The barbell's facing the camera. Last one, bud. Turn right here. Go ahead. Very nice. So the bar traveled a little bit back on that one. Okay, that's what we're looking for. Very good stacked position. Barbell is behind the ear, which is above the shoulders, and it's above the hips, and it's directly between his 2 feet. That's exactly where we want to be. Back down. Good. Rest. Very good. So overall, we found some weaknesses that we need to work on, whether that is soft tissue, whether that is bony structure. He has an old ankle injury. He has had an ongoing wrist injury. In this sport, wrist and elbow injuries are very common, and sometimes you need to train around them. As a whole, very good job today. We need to address more unilateral work. We need to address maybe some side planks and some things to maybe prevent that rotation. Rotation was consistently to the left and barbell tilt to the left throughout multiple exercises. So that's something we need to maybe work on his hand grip, hand width, maybe work on wrist mobility, work on lat mobility. All these things that we assessed that were deemed as weaknesses, core control, right? Does not mean he is not safe to compete in the sport. He's competing currently, he's competing at a very high level. He needs to work on these other little things to hopefully prevent injury in the future and to help maximize his potential in the sport. You have any questions for us?
Yes, sir.
Great job today, man.